To remind you, I'm Diane Benford. I'm a member of the EFSA Scientific Committee and chair of the EFSA Cross-Cutting Working Group on Genotoxicity. I'm a toxicologist with a lot of experience in risk assessment rather than deep experience or expertise in genotoxicity. And I think that's enough of me. So, workshop 1 was charged with discussing the risk assessment of genotoxic compounds when we have data from a carcinogenicity study. So we divided the discussion into hazard identification, characterization, and risk characterization. And to start with respect to hazard identification, we discussed what should be considered as adverse. And it was said that any interaction may result in an adverse outcome and could be seen at any level, especially the molecular level. The effects could be transient or persistent, and whether something is considered adverse could be dependent on whether or not the effects were transient. And an initiating event would be anything that leads to the known adverse outcome and needs to be investigated case by case. We had some discussion as to different possible causes of carcinogenicity and the difficulty in determining when genotoxicity is not relevant if other modes of action, such as endocrine effects, were more relevant. So we then discussed thresholds and whether we could assume that there were thresholds for mutagenic effects. There were different views amongst the audience, amongst our workshop participants, just as there were for virtually everything else. It was said that everything could have a threshold. The challenge is to identify it and how many studies, animals, species are required to confirm it. Different events, different modes of action also add complication. DNA repair is not always completely error-free, and so that doesn't necessarily guarantee that there's going to be a threshold. It was said that if we don't see something, that doesn't mean that it's not happening. It's a matter of sensitivity of the tests. And currently, it's not really possible to identify thresholds. But if it assumed there is a threshold, which experimental data would be required for identification of such a threshold? And again, we said different modes of action should be investigated. We should consider the most sensitive species, organs, tissues, etc., different developmental stages, which maybe seems to be implying a lot more data requirement than we currently have. Similarly, for in vitro studies, should there be a minimum set of different cell lines and types in addition to those currently used? And for in vivo studies, would statistical power need to be increased by, for example, having more animals per group? And of course, we recognize that there would be animal welfare considerations there, and it might be difficult to get approval for increasing number of animals when applying to ethics committees for doing animal studies. Would it be possible to identify no observed effect level or low observed effect level with or without the adverse in the middle of that? And if so, would it be appropriate? So we said if a threshold could be identified, then it should be possible to identify a no L. But a BMD calculation would generally be more appropriate regardless of whether or not we're considering a threshold, because the BMD takes into account or the BMDL, for example, takes into account the uncertainties in the data. We discussed possibilities and limitations in qualitative approaches to hazard characterization for genotoxic carcinogens. One of the limitations, of course, is that there's currently no validated tests for local effects, for site of contact effects, other than in the COMET assay. The qualitative approaches don't provide tools for prioritization of risk management, but studies on transcriptome, metabolome, and so on may help to improve knowledge on the mode of action and inter-individual variability. Moving to quantitative approaches, of course, currently we only quantify risk based on carcinogenicity data, which is the topic of our workshop. But evaluation of mutagenic potency could have uses, such as, for example, in read-across. If you have one group of chemicals, a group of chemicals, if you have one member for which you have carcinogenicity data and other members for which you don't, then that would help read across. But variability is a limitation, and maybe there's a need for greater standardization of methods. There was a suggestion that to get around this problem of variability in the control data, the results of a test material could be normalized against the positive response of the positive control substances. And that would be useful to investigate that further. Epidemiological and human biomonitoring data could also contribute to the weight of evidence. And we thought it would be useful to have more investigation of concordance between genotoxicity and carcinogenicity data. And again, quantitative approaches would allow better interpretation of risk measures. So we saw quite a lot of possibilities for use of quantitative approaches, but limitations in what we can do at the moment. We discussed tools for quantitative characterization of genotoxicity and thought that the BMD calculations would generally be possible for OECD guideline studies, but there may be a need for further training on BMD modeling. It's not something that you can just push the numbers into the software and get out a meaningful result necessarily. You need to know what you're doing. The quantitative variability of the in vivo COMET assay present challenges for benchmark dose modeling, because it could result in very large uncertainty, very large space between the lower confidence interval and the upper confidence interval. And a question again as to whether more tests would be needed in order to investigate the different endpoints that need to be investigated. For studies that could be used to determine a reference point for risk characterization, we wanted to see a test battery, which clearly we have at the moment, but then is that sufficient to cover the most sensitive and relevant endpoints, or are more tests needed? If we only have in vitro data, we would need toxicokinetic modeling to extrapolate to in vivo, or we could use in vivo studies. And again, human biomonitoring and epidemiological data might be supportive, but there are generally more uncertainties there than in the animal studies because of the lesser control than you have for animal studies. We discussed whether AOPs and results of AOPs can be used. We noted that they currently already are in use in the pharmaceutical industry as part of the weight of evidence. So clearly there is possibility there. But the complexity of the pathways and different tumor types and so on that could be generated meant that the AOPs are going to be complicated and difficult to interpret. And at the current time, it was felt that we still need the carcinogenicity study. Obviously, going forward, you'd like to think that we wouldn't. And at the moment, AOPs are not relevant for quantitative evaluation as opposed to hazard identification. So, but the work is ongoing, and it's a question of watch this space, and we hope there will be future developments. Discussing the BMD modelling, it was felt that it could be applicable, that the EFSA recommendations could be applicable for genotoxicity data, but we wanted advice from experts in statistics with respect to whether the statistical power of the current study designs as defined in the OECD guidelines is adequate to produce robust results for the modelling. And maybe more discussion on what should be a proper study design for BMD modelling, although again recognising if that resulted in use of more animals, that might not be considered acceptable. And there was also, it was also mentioned whether aspects of the mode of action, such as DNA repair, could have an impact on the BMD modelling. So there were a number of issues to be discussed here, I think. We had a lot of questions, not necessarily many answers. We also touched on the critical effect size, or the benchmark response for mutagenic effects, and I'm sure we'll hear more about this from workshop 2. But from workshop 1, we thought that it's difficult to establish what critical effect size is considered as adverse, which is part of the definition of a benchmark response or critical effect size in the current guidance. Would there be a need to deviate from this question of adversity and just rely on statistical considerations? But then, is the statistical power sufficient? And then, thinking about risk characterization, we noted the different approaches of margin of exposure and the DMAL, which is used in ECHA. And members of the workshop felt that these are sufficient for most regulated substances, but could be improved for non-regulated substances. It was felt that there's currently no agreement on a tolerable level of risk, and maybe more discussion with risk managers is needed here. It would be helpful to know more about the dose response at low doses, and maybe quantitative analysis of genotoxicity data could help inform on the dose response at lower doses than have been tested in carcinogenicity studies. And that might help us to give better advice to risk managers, for example, in the case where exposure is below the margin of exposure, the margin of exposure is below 10,000, as currently defined in the EFSA guidance. The EFSA guidance, which is quite old now, refers to the T25, and we have some reservations about that because it doesn't take into account uncertainty, unlike the BMDL approach. Concern about possible mixtures effects. So if you have one substance with a margin of exposure of 10,000 of low concern, but then you have 9 other substances similarly with a margin of exposure of 10,000, and they have possibility for additive effects, does that mean the overall margin of exposure is only 1,000? Would need to be discussed. And if we have carcinogenicity data that are negative, but the substance is genotoxic, what do we do then? We don't, at the moment, have a way of doing a risk assessment for such substances, and it just relies on the hazard identification. So there's a clear need for quantitative approaches to the genotoxicity there. The pros and cons of the different approaches. The margin of exposure provides information on the level of concern, but it's not intended to describe a level of risk, and that can, in some circumstances, cause difficulties for risk managers. The DMAL describes a risk separately for workers and for consumers and leads to a permissible concentration. but again, it was felt that more guidance on acceptable risk level would be needed. We discussed whether there was a need for harmonisation, and it was said that harmonisation of the data requirements for hazard identification of the basic test battery would be helpful, but harmonisation of the MOE and DML was not so important because they're used for different purposes in different circumstances, and members of the workshop were comfortable with that. Again, considering the margin of exposure of 10,000 and whether it's always adequate to cover other endpoints that might arise from genotoxicity in addition to carcinogenicity. We weren't aware of any indications that it's not adequate, but it was said that there may be a need to consider a higher value as being of low concern if there were substance-specific data to justify that. And if we're looking at genotoxicity data, then obviously there's a need for extrapolation from short-term to long-term, which was already discussed by Paul White on Monday. And we felt that it would be good to see more systematic comparisons of the BMDL from carcinogenicity data with BMDL from genotoxicity data for the same substances in order to see how these compare. We'll skip over this one because we didn't really say very much about linear extrapolation. So overall, we've agreed that our common aim is to protect humans. We are where we are at the moment. We need a lot more discussion and information on how to use genotoxicity data in a quantitative manner. But clearly, as knowledge increases, then our procedures could change. And I think that is the end of my presentation. So thank you to the rapporteurs for pulling all this together.